The promising news is that while 2,253 people did die in BC from the toxic drug supply last year, the number represents a 13% decline over the previous year, 2023. The decline is mirrored across North America, but the greater Campbell River health area is going in the opposite direction. It experienced the third highest number of toxic drug deaths in BC, only behind Vancouver Centre and Lillooet, with a rate of 109 deaths per 100,000 people last year, an increase of 5%.
We don't know for sure why that is.
Sue Moen heads the local Campbell River Community Action Team and knows many of the people on the street who use drugs. But she has news for anyone who thinks these are most of the people who are dying.
81% of the people who died locally, those human beings who are loved and missed by people, were in housing. More than 55% of them were in private residences.
And many of those who died had a job.
They are professionals of all kinds. There is a significant skew towards labor and the trades, but also hospitality. But there's lots of just recreational substance users.
It might be a change in the drug market, and it might be a change in the number of people who are using unregulated substances.
The BC Centre for Disease Control says fentanyl is still the main substance of concern in drugs, and that its toxicity can change from area to area, but there are other substances as well.
Benzodiazepines are one substance that's in the supply that causes even a higher likelihood of drug poisoning. It does seem that there are, batches and different production in different parts of the province.
Sue Moen says people who use drugs alone in their home, often in secret, aren't reaching out for help from harm reduction services or doctors.
Because they could lose their job, they could lose their family. They are made pariahs if they are associated with the visible and face of substance use.
Since the toxic drug public health emergency was first declared in April 2016, over 16,000 people have died in BC.